Okay, so hi everyone, my name is Maria Smith. I'm a paramedic here with Gaston EMS. I'm taking a methodology class and I'm going to lecture for a little bit about Lamaze. Does anyone know what Lamaze is, or has anyone ever taken a class? Breathing? Okay. Is anyone planning on starting a family soon, or is anyone currently pregnant? Okay. Are you planning on taking a Lamaze class?
Yes.
You are? Okay. Well, you'll learn a little bit today. So Lamaze, the Lamaze method was developed by French obstetrician Ferdinand Lamaze. It made its way into the United States around the late 1950s. The Lamaze method was originally just breathing exercises to help women cope with labor, and then over time they've incorporated more things into the classes. So Dr. Lamaze had a philosophy. He wanted everyone to know that birth is normal, it's natural and healthy, and that women have a right to give birth free from routine medical interventions. So why is labor feared? So labor is feared for many different reasons. For example, women fear the pain. They fear contractions. They fear what if something goes wrong. So the more you know, the better prepared you're going to be for whenever this time comes. Okay, so does anyone know what a contraction feels like, or has anyone had a baby?
No, but I've had kidney stones and I've heard it's pretty much the same thing.
Okay. Have you had a contraction before? Okay, 3 kids. Okay, so what was the contraction? What did that feel like?
Like a blood pressure cuff around your abdomen.
Okay, so a lot of tightening. Okay, has anyone ever felt a cramp before? Yep. Can somebody describe what that cramp felt like? Okay, so a lot of tightness, a lot of sharp pains. So from personal experience, whenever I experience a cramp, it's horrible tightening, sharp pain, where whatever muscle that is tightening, and all you're thinking about is how bad it hurts and how much you want it to go away. A lot of things that I usually do is just try to stretch out the muscle. I try to walk around and just hope that it's going to work and it's going to go away. So a contraction has often been associated with the pain of a cramp. So a contraction is periodic tightening and relaxation of the uterine muscle. So the best way that I can describe it is that it's going to feel like one of those cramps across your abdomen, but instead of it decreasing in pain and duration, it's going to increase in pain and increase in duration. So it is going to be painful. So who do you guys think would benefit from Lamaze, from taking a course? Yes, so a pregnant lady is gonna benefit the most, but it's not just her. So it's going to be her, whoever her spouse or support partner is. They're all going to benefit. So anyone who's directly involved in the birthing process is going to benefit. And the reasons why they benefit is, like I stated earlier, the better you are prepared for something, the more you know about it, the better you are going to be whenever that time comes. So especially for the husband or for whoever your support partner is, it helps them build confidence once they know what their role is going to be. So once they know how to be able to coach you through it and how to take some of that pain away, how to help you, they're going to feel more confident and not feel like they're just watching you in pain. So a lot of women get the epidural. So the epidural is an injection that goes into your lower back, and it provides pain relief by blocking some of the nerve impulses in the spinal segments. So whenever you receive an epidural, you lose feeling from the abdomen down. So that helps a lot to relieve the pain from the contractions, but it does have, like any other medication, it does have its good and its bad. So one of the good is that it's highly effective. It can take some or almost all the pain away from those contractions, but some of the side effects is that it takes away the inability for the mother to know when she has to push. So she has to rely on the nurses telling her it's time for you to push, and she can't feel her body. So she's just trying to remember what pushing would feel like. Also, it is going to have some effects on the baby. Research says that newborns struggle with latching on as soon as they're delivered. So it kind of interferes between that bonding moment between the mother and the baby when the baby can't latch. It can also decrease the respiratory depression in neonates, and it can also decrease the heart rate in the neonate. So a lot of those women take into considerations when they're planning on having their baby. They don't want to go through any of these risks, so they want a natural birth. So by natural, they don't want to put their baby through this stress. Excuse me. So that's why it's so important for the woman to stay focused on what it is that she wants to do and kind of have a game plan before she goes into labor. Do I want the medicine, or do I want to do this the natural way? If so, what kind of things can I do, and can my support partner help me do so that we stay on the same focus? So, excuse me. So the Lamaze breathing exercises. So these were the first. Now there's several different breathing patterns. These is just some of them. The first one is a cleansing breath, and it's just a slow, deep inhalation through the nose and an exhalation through the mouth. So cleansing breaths are used at the beginning and at the end of each contraction, and it also signals your support partner when you're having a contraction. So if you all just want to practice this one, it's just a slow inhalation and a slow exhalation. The blowing breath is just a slow breathing through relaxation. So whenever you're not having a contraction, this is the breathing method that you would like to use during that. So it's just blowing out a candle. So if you want to practice in through the nose and just like that. The pattern breathing, that's the famous that most people associate with Lamaze. So this one is used later on in labor, and it's a soft, small inhale in between each exhale and a blow. And you're going to wrap this around into the cleansing breath. So if you all just want to practice that. Yep. So whenever the pain increases and you're getting deeper into labor, this is the one that you want to focus on. Now, you don't have to do it in this order. Whichever method the mother feels most comfortable with, then she can just keep that one. They're just examples. Okay, so as I stated earlier, Lamaze used to be just breathing exercises. And over time, they incorporated different kinds of relaxation techniques that mothers liked, and they started putting them into Lamaze classes. So different types of relaxation techniques would be a massage. The kneading massage is using both of your thumbs and the heel of your hand, and you work a pattern through wherever it is that she's having the pain. The other one is a leg massage. You can keep the mother's legs elevated. You can rub them on the sides and apply whatever pressure that the mother desires. So I'm going to show you this video that uses some of these massages. Okay, and you can start taking Lamaze classes as early as 27 weeks. So this is the position that you would want the mother to be in. You want her to be where you can access her back, because that's where she's going to be feeling most of the pain. But you want to make sure that she's not pressing up against her belly. So you want to have her like this and just kind of have her relax while you're doing these different types of massages.
easier on my own back as well. Go ahead and keep breathing nice and rhythmically, stepping in that hollow. For me, I'm going to just watch the rise and fall of her back here, so I know where she's breathing out. This is going to help the pelvis to relax so that the baby can drop farther down. So this helps Stephanie move into the final stage of labor. When mom's in labor, you can press directly on the sacrum and even with your fingers directly down the sides of the sacrum. That's not something that we recommend during pregnancy. But when she is in labor, her partner will be pressing directly onto the sacrum and harder than we've ever pressed before and holding it for 8 to 9 seconds and releasing.
Okay. So remember, you're using whatever pressure she wants. If she wants more pressure, you apply more, and if she wants less, then less. So with this one, keeping the mother active, having her walk around, having her stretch out her muscles is also going to help decrease the pain.
And then partner, you can see my hands are in the perfect position. So if you don't see the here, down, and I am thinking about her and massaging along her spine. I might be holding her right here at the sacrum and grounding her and helping her to ground. When a contraction comes, you might be trying to stop and just hold her while she really leans against you and breathe with her. And we're going to move again back and forth. And that, my dear,
Okay, so these are some of the things that you want to keep in mind whenever, if you're using one of these techniques. Remember the pressure, you are going to use whichever one the mother wants, and make sure she's comfortable with what you're doing, that you're not making it worse, and that she's not pressing up against her belly. Okay. Okay, so that kneading massage that I talked about earlier, this is just a picture where she's doing that. So remember, you can do that wherever she's having that pain at, and that's going to help her with the pain. So aside from massages, there's a lot of different kinds of relaxation techniques aside from the massaging and the breathing exercises. Another common one is the tennis ball. With this one, you place 3 tennis balls inside of a sock and you tie the end and you just roll it up and down the mother's back with the pressure that she desires. Another one is a rice sock. So with this one, you grab a sock, you fill it up with rice, and you heat it up in the microwave for no longer than a minute. And this is going to help with the aching muscles. It's also going to feel like a heating pad for her, which is good for cramps and achy muscles. So here I have something that I made. It's just a rice sock, so you guys can feel what that would feel like if you'll just pass it around. A lot of different relaxation techniques. Really during any part of labor, you're looking for what's going to keep her calm, what's going to keep her on her focus, and what's going to help her out the most. So you can also incorporate music. If there's a certain type of music that she likes that keeps her calm, you can take some of these CDs or musics to the hospital with you. A photo, if there's a photo that you can look that she likes, that she wants, whether that be an ultrasound photo or a picture of her family, so that she remembers the goal and why she's doing this for and how strong she is, and just keep her nice and confident. One of the newest relaxation techniques is the hydrotherapy. So with this one, a lot of mothers feel that their pain decreases with warm water. So whether that be taking a nice warm bath at the hospital or taking a nice warm shower, the warmth of the warm water on their bodies takes away some of that pain. The hydrotherapy is used normally during the beginning stages of labor and at the discretion of your nurse. So if you're too far into your labor, they're not going to want you to do that because they're not going to want you to deliver and take that risk. So what are the goals of Lamaze? So the goals are to build confidence during labor for everyone involved, so that everyone knows their role and everyone is calm. To keep the mother focused on her goal. If her goal is to have a natural birth, then that way she remembers and she knows what she has to do to not get an epidural or to not rely on other medications, whether that be breathing techniques and working through the pain, massages, music, whatever's going to keep her focused. And in the end, to facilitate labor as much as possible for everyone. So, and your happy ending. Does anyone have any questions? Nope. Okay. Did he turn that off? Can someone look, please?